If anyone tells you that you treat acne or pimple and it will never come back again, just follow a one step or one regimen and that is all. That person is lying to you. You cannot treat acne or pimple and then you are done. The reason is some of the factors that contribute or triggers or causes the outbreak of pimples are still in our system. They don't change, they're still there. So they'll keep causing outbreak. They'll keep causing recurring pimple. So that's why I'm dedicating this particular video to explain the factors so that you understand which factor is causing the pimple, the ones you can change and the ones you cannot change. The ones you cannot change, I will be telling you what you need to do so that the pimple, the acne will not come back. The treatment plan for acne is based on the type of acne or the causes of the acne. If you do not understand the trigger, you can be having recurrent acne like I said before. One of the triggers of acne is pregnancy. When we are pregnant, there is increased testosterone hormone in our body, which triggers increased production of sebum, and this also leads to increased clogging of pores and then increased frequency of outbreak. When we are pregnant, we are already pregnant. We cannot change our pregnancy. So this is one of the causes or factors that triggers acne that cannot be changed at least for 9 or 10 months. Pregnancy can also lead to increased pH hormone, which can cause the bacterial organism on our skin to outgrow their normal number and then leads to inflammation, which will lead to inflammatory pimple. Stress that comes with carrying a new being in our body can also trigger acne indirectly. So what can you do concerning pregnancy acne, pregnancy-related acne? Two things you can do is developing a skincare routine based on your skin type and the type of acne that you have that can take care of that outbreak and prevent it from happening. Genetic factors can also contribute to acne outbreak. Genetic factor has been shown that some family history, like your daddy had, your mommy had, your sibling had, uncle had, things like that, family history of acne has been shown scientifically, and that there is a relationship between genetics and sebum production, which is the oil that our skin produces. So some people have genes that make them produce excessive oil in the skin, which is what we call this oil skin type. And then some people don't have oil on their skin. Then there's a relationship between bacterial proliferation. Some people they are more prone to the bacteria growing excessively on the skin, especially when they enter certain age. So genetic we cannot change. We've been born with that gene. We can't change our gene. So what can you do for a gene factor related acne? The same thing with pregnancy. Developing a skincare routine based on your skin type and the type of acne that you have, and then some lifestyle modification. Drugs can also trigger acne. Certain drugs have been shown to cause outbreak of acne. Drugs like corticosteroid, example prednisolone, drugs like some anticonvulsants like carbamazepine and phenytoin, drugs used for treatment of depression or bipolar like lithium. Some contraceptive pills have also shown to cause acne outbreak. For drug, there are two ways. You can change and you may not be able to change. If you are using the drug to treat a secondary condition, you may not be able to change that drug. For instance, maybe the lithium is used for treatment of depression and there is no other antidepressant drug that is working for the person. So the health professional is not going to change it for you. The only thing you can do is to develop some skincare regimen and some lifestyle modification. But some drugs can be changed. Some contraceptive pills can be changed. Even some corticosteroid can swap to another form of anti-inflammatory drugs that are not corticosteroid if the reason for giving the corticosteroid is inflammation. So for drug, if you talk to your healthcare professional and he says they can't change your drug, develop a skincare regimen that can help you battle the acne outbreak and prevent it or reduce it to the barest minimum. But if the drugs can be changed, fine and good. Cosmetics also have been shown to cause acne outbreak. Using the wrong cosmetic for your skin type. Some people have oil skin, some have dry skin, some have combination skin type. When you use oily product on an oil skin already, this will lead to blockage of the pores and and often at times lead to outbreak of acne. So know your skin type and know the type of products that you need. How will you know? By reading the ingredient parts of those products. Every cosmetic have their ingredient parts. You can do research, your own little research, although I'll be doing breakdown videos on all this that I've pointed out. But you can do your own little research on the products you're using, the ingredients in those products. Are they commensurate with my skin type? I've also give a video on how to check your skin type, how to know the type of skin that you have. Another thing that could cause it is using comedogenic ingredients. Comedogenic ingredients are ingredients that cause blocking of pores, ingredients that contains oil, heavy oils, things like coconut oil, things like shea butter. So if someone has an acne prone skin, it is advised that the person stay away from such products that contain coconut oil and shea butter. Another one is poor skincare routine, in the sense that when you are done applying cosmetics or makeup on your face, you do not clean it up. You sleep with it, you leave it on your face and then leave it overnight. Leaving cosmetic products on your face can lead to blockage and proliferation of bacteria, which can lead to both blackhead and whitehead and even inflammatory pimples. So if you wear your makeup when you're about to sleep, clean it off, wash it off before you go to bed. Another condition that can cause acne outbreak is polycystic ovarian syndrome, PCOS. This condition is manageable, it's treatable too, but prior to the treatment, you will not be able to change the condition. It is there for a while. So what can you do? Develop a skincare routine that will help you manage acne outbreak. And how does this even cause acne outbreak? Polycystic ovarian syndrome increases production of testosterone, androgen hormones in the body, which will lead to production of more sebum in the body and then clogging of pores and proliferation of bacteria, and then acne outbreak will result from it. It also leads to resistance in insulin, and once there is resistance in insulin, our liver is sent a message by our body to produce more insulin, and the more insulin our body produces, the more testosterone our body produces, and the more sebum oil our body produces. So this type of condition actually leads to a very severe form of acne. So in this type of condition, if it's given, it can lead to severe, it can lead to mild acne. If the acne is mild, develop a skincare routine, which I will be telling in next episodes that will follow this video. Develop a skincare routine and lifestyle modification. But if the acne is severe, you need to see a dermatologist. Another one that can cause acne outbreak is mechanical occlusion. Acne can occur on face, on the back, on the shoulder, on the chest. So when we wear tight-fitted clothes, we can cause mechanical occlusion on our skin. Tight-fitted clothes on the face, like hairband and hairnet or hair hats, and then tight-fitted clothes like tightly fitted materials like t-shirts, gowns, and even medical dressing. Medical dressing left for a very long time can cause acne outbreak. The mechanism of how this happens is it causes increased moisture on the surfaces that have been occluded, and then when there is moisture, the oil that our body is supposed to be exuding will not be able to come out. It will be trapped on the skin, and then leading to a rich environment for bacteria to grow, and then proliferation of bacteria, which will result to acne outbreak. Another factor is touching your pimple or popping the pimple yourself. If you want to pop pimple, there are spa salons, spa services, dermatological services for popping pimple. So you can pay for such services. But I would advise you do not touch your face, because touching the face is going to spread bacteria from one place, from one skin to another skin, from one area of the skin to another area of the skin, and also touching it is going to cause increased inflammation, due to the fact that the more you touch the skin, the more abrasion, friction it will cause, and then the more the skin will react. And then increased inflammation will also lead to increased scarring, which is going to make that pimple to leave a scar when it finally heals, and for vascular pimples to take a while to heal. So it's not actually advised to touch or to pop pimples. So in all these causes or the triggers of acne, it can be divided into two: the triggers you can change and the triggers you cannot change. The triggers you can change include drugs, which can be changing to another drug, touching your pimple, stay away from touching the pimple, mechanical occlusion, wear light fitted clothes so that air can go in, dry up the moisture and come out. Avoid cosmetic products that will cause occlusion, cosmetic products that will cause irritation, cosmetic product that contains homogenic ingredients. So when you want to buy cosmetic product, buy cosmetic product that the free homogenic ingredient, sensitive skin and or non-irritant skin. Then for polycystic ovarian syndrome, you can talk to your healthcare provider to help you, give you drugs that can reduce testosterone production and also in return reduce outbreak of the acne. For the drugs, there are some drugs you can change, and pregnancy can change, genetic you can change, polycystic ovarian syndrome. Sometimes you may not be able to change the drugs. I've explained that in the slide pertaining on this. So the lifestyle modification and appropriate skin care routine is what you need for those factors that you cannot change. Have a lovely day. Bye.